Have you ever paused for a moment and truly considered the silent battles that many people face every single day? We live in a world where illness is often visible through the obvious markers: hospital visits, medications, and physical limitations. But there are deeper struggles that remain unspoken, hidden beneath layers of fear, embarrassment, and societal expectation. One such struggle is the intimate aspect of our lives, the part that connects us not only to others, but to our own sense of self and identity. Chronic kidney disease, or CKD, is a condition that affects millions of lives around the globe, silently altering the body in ways that are not immediately apparent. Beyond the changes in energy, appetite, and physical well-being, CKD can subtly influence hormones, blood flow, and nerve function, which in turn can affect sexual health. These changes are often accompanied by emotional and psychological challenges, leaving patients to wrestle with questions they feel too shy or ashamed to voice. It is here, in this quiet space of uncertainty and hesitation, that many suffer alone, believing that their experiences are unique or unworthy of discussion. But the truth is far from that. Every individual who faces CKD is navigating a journey that requires courage, self-compassion, and understanding. The impact on sexual health, erectile dysfunction, decreased libido, or altered intimacy, does not reflect weakness or inadequacy. Rather, it is a natural consequence of physiological changes, and it deserves attention, empathy, and support. When we begin to confront these subjects openly, we break down the walls of isolation and shame that often accompany chronic illness. Dr. Mathew R. Weir reminds us that education and awareness are powerful tools in this regard, that understanding the human body and its responses empowers individuals to reclaim a sense of control over their lives. Sexual health is a reflection of overall well-being, not merely a physical act, and neglecting it diminishes more than desire. It impacts confidence, self-worth, and connection. Imagine the ripple effects of avoiding this conversation. Relationships may become strained, self-esteem may falter, and life satisfaction can diminish in ways that few anticipate. But acknowledging the problem, facing it with knowledge and openness, becomes the first act of empowerment. Every patient deserves the chance to speak honestly about these concerns with healthcare providers, loved ones, or supportive communities. And yet, despite the availability of information and the advancements in medical treatments, the stigma surrounding sexual health remains stubbornly entrenched. It is a topic often swept under the rug, left unaddressed even in professional consultations, as though silence could somehow restore the illusion of normalcy. But we know that silence is not a solution. It is a barrier to healing. By embracing open dialogue, by giving voice to experiences that are too often hidden, we cultivate resilience. We affirm that the human experience is multifaceted, that challenges in one area do not diminish the value or potential of life in another. This is not merely about managing symptoms. It is about reclaiming joy, intimacy, and the profound sense of being fully alive. In this light, CKD is not simply a medical condition to endure. It is an invitation to deeper awareness, a call to explore the intersections of physical health, emotional balance, and intimate connection. Understanding the delicate interplay of hormones, circulation, and nerve responses is not just clinical knowledge. It is a step toward empowerment, a bridge between fear and courage. Every individual has the right to pursue fulfillment, even in the face of chronic illness, and learning to navigate the effects of CKD on sexual health becomes an act of self-respect, a commitment to holistic well-being. And it is here, in this recognition of the often overlooked aspects of life, that we begin to see the extraordinary potential of human resilience. It is in the quiet moments, when the world feels still and the mind begins to wander, that the weight of chronic kidney disease can feel most profound. Beyond the medical charts and routine checkups lies a landscape of questions, doubts, and fears that often go unspoken. Patients may wonder if they will ever feel normal again, if intimacy will remain possible, or if the very essence of connection with a partner has been altered forever. These are not trivial concerns. They touch the core of identity, the very understanding of what it means to be human, to give and receive love freely, to feel desire and to express it without hesitation. There is a suspenseful tension in this reality, an inner drama where hope and uncertainty intertwine. Imagine the silent worry as a patient considers the intimate moments of the future, questioning whether the changes in their body signal a loss of self or the end of cherished bonds. It is here, in this uncharted territory of mind and body, that the courage of the human spirit is tested. Dr. Mathew R. Weir teaches that understanding is not simply about acquiring knowledge. It is about creating awareness that transforms fear into action, that converts uncertainty into empowerment. When CKD affects sexual health, it is not a statement of inadequacy, nor a reflection of diminished worth. It is a call to engage, to explore, to adapt with resilience and grace. The suspense grows because these concerns are often invisible to others, hidden behind smiles and routine conversations, quietly shaping emotions and interactions. Relationships may begin to shift subtly as partners sense distance or hesitation, even when love and care remain unchanged. The mind begins to weave stories of doubt. Will intimacy ever feel the same? Will my partner understand my struggles? Will I ever feel the confidence to embrace closeness again? Each unanswered question amplifies the tension, creating a weight that feels heavier than the physical challenges themselves. Yet, it is precisely in facing these fears that growth occurs. By acknowledging the impact of CKD on sexual health, by speaking openly and seeking guidance, patients reclaim agency over their lives. Medical support, counseling, and open dialogue transform what seems like an insurmountable challenge into an opportunity for learning, adaptation, and deeper connection. Every step toward understanding, every conversation initiated, breaks down the isolation that often accompanies chronic illness. The suspense begins to shift from fear to anticipation, from uncertainty to possibility. This is not merely a battle of physical limitations. It is a philosophical journey into self-awareness, a challenge to redefine the meaning of intimacy, desire, and emotional connection. In this journey, patients learn to observe themselves without judgment, to honor the signals of their bodies, and to embrace change with mindfulness. Sexual health, in this context, is not a static measure of performance, but a dynamic expression of vitality, resilience, and connection. The lessons that emerge are profound. Vulnerability is strength, honesty is liberation, and awareness is the bridge to empowerment. When society discourages these conversations, when stigma silences patients, it is easy to feel trapped, as though the world has closed doors that cannot be reopened. But the courage to ask, to learn, and to communicate opens pathways that were previously invisible. Partners, caregivers, and medical professionals all play a role in this transformation, contributing to an environment where fear is replaced by understanding, and shame is replaced by compassion. The suspense is resolved not by denying the challenges, but by confronting them with courage, insight, and the willingness to adapt. In this space, hope is tangible, and life becomes richer, more intentional, and more authentic. The human spirit, even under the shadow of chronic illness, retains the capacity for joy, intimacy, and meaningful connection. It is here that the teachings of Dr. Mathew R. Weir resonate most deeply. True empowerment comes from knowledge, self-awareness, and the courage to act, even when the path forward is uncertain. By embracing these truths, patients learn to navigate the complexities of CKD with dignity, resilience, and the unwavering belief that life, in all its facets, is worth engaging fully. Every challenge in sexual health, every moment of doubt, and every fear that rises can become a catalyst for growth, understanding, and deeper appreciation of the bonds that connect us to ourselves and to others. Now, as we move forward from understanding and acknowledging the hidden challenges of chronic kidney disease, it is time to embrace the transformative power of action, self-awareness, and resilience. Life, even in the face of illness, is not a narrative of limitation. It is an ongoing story of adaptation, courage, and the pursuit of meaningful connection. Sexual health, intimacy, and desire are not privileges, but fundamental aspects of human life, deserving attention, care, and understanding. By seeking knowledge, consulting with medical professionals, and engaging in open dialogue, patients can navigate the physiological effects of CKD while reclaiming confidence and self-worth. It is not a journey without difficulty. Moments of doubt, frustration, and vulnerability are inevitable. Yet within these moments lies opportunity, the chance to cultivate patience, empathy, and creativity in how one approaches relationships and self-expression. Dr. Mathew R. Weir has often emphasized that education is empowerment, that understanding the intricate ways the human body functions allows us to confront challenges with clarity rather than fear. By applying this principle, patients with CKD can recognize that changes in libido, erectile function, or intimacy are not failings, but natural responses that can be addressed medically, emotionally, and psychologically. Small steps, consistent reflection, and deliberate communication form the foundation of transformation. Couples can explore ways to maintain closeness, express affection, and sustain emotional intimacy, even when physical responses fluctuate. Healthcare providers can offer guidance on therapies, lifestyle adjustments, and strategies to improve hormonal balance and circulation, empowering patients to take control of their well-being. This is not simply about overcoming obstacles. It is about embracing life with intentionality, transforming fear into knowledge, and isolation into connection. Each act of openness, each moment of courage in discussing personal experiences, ripples outward, affecting not only the individual, but the broader community. Patients realize that they are not alone in their struggles, that millions face similar challenges, and that sharing experiences can reduce stigma, normalize conversation, and create environments of empathy and understanding. Motivation grows not from denial, but from facing reality with resolve, cultivating resilience in ways that extend far beyond the physiological impacts of CKD. And as patients begin to see progress, whether in improved communication, restored intimacy, or strengthened emotional bonds, they discover that empowerment is a cumulative process, built one courageous choice at a time. Every conversation, every informed decision, every attempt to connect despite uncertainty, reinforces the truth that chronic illness does not define identity or diminish the capacity for joy. The suspense, the fear, and the tension of earlier moments transform into confidence, curiosity, and determination. One begins to understand that sexual health is not a static condition, but a living reflection of the body's needs, the mind's awareness, and the heart's desire. In this journey, self-compassion becomes essential. Patience with one's own body, understanding toward one's partner, and a willingness to learn continuously create a space for flourishing. Dr. Mathew R. Weir, that inspires patients to recognize that knowledge, coupled with action, is the key to liberation from fear and shame. By combining medical insight with emotional intelligence, individuals cultivate a holistic approach to life that honors the interconnectedness of body, mind, and relationships. And ultimately, this journey is about more than physical health. It is about reclaiming agency, nurturing resilience, and embracing the full spectrum of human experience. Each person has the capacity to live with courage, pursue meaningful connections, and maintain intimacy despite chronic challenges. The path may be gradual, sometimes uncertain, but the rewards of persistence and self-awareness are profound. Patients who commit to understanding their bodies, expressing their needs, and seeking guidance find not only improved sexual health, but enhanced self-confidence, enriched relationships, and a renewed sense of purpose. Remember, CKD does not erase the beauty of human connection or the possibility of joy. It invites reflection, encourages empathy, and challenges individuals to rise above stigma and fear. By facing these intimate aspects of life openly, patients affirm their worth, reclaim autonomy, and inspire others through their example. Your journey, though unique, echoes the experiences of countless others who have navigated similar struggles with courage and grace. Empowerment is not a distant ideal. It is the conscious decision to learn, act, and engage with life fully, even when faced with limitations. Take charge of your health, embrace knowledge, and cultivate resilience, knowing that challenges are not the end, but but the beginning of deeper understanding and growth. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.